morning.
Good morning.
How are you?
Great yourself.
I am fabulous. It's Saturday. Yay. I feel like I survived.
Yes, you did.
Oh, I'm trying to make it, trying to survive. Lord Jesus. Oh, okay. Well, let's get this party started. Let's get it started. Welcome to our Saturday morning tea, where we discuss health information, news, education, all types of information, and certification tips. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And before I introduce my co host, today's episode is sponsored by the Professional Reimbursement Network's free email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding, but not sure where to start? And scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. All right. So if you are in Clubhouse, and welcome to our Clubhouse friends, we got Asha and Ruby. Feel free to click the link. If you are joining us via Facebook and YouTube, welcome. And you can check the video description box for the link information. So joining me today is my trusted, illustrious co-host, Mr. Jesse, the I said I was gonna get this right. The coding nurse. Coding nurse. How do I supposed to say it?
Registered trademark.
Registered trademark coding nurse. The coding nurse, right? Right. Let me write this down right now. Registered trademark. The coding nurse. Okay, I'm gonna put that in my notes. I'll be next week. I'll be on it. So, sir, introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I live in Philadelphia, Pennsylvania. I have been a nurse for 29 years, LPN. In 2020, I created a company, the Coding Nurse LLC, where I help nurses transition away from the bedside into the world of HIM, and I help them obtain certification.
Cool. Fabulous. Okay. Make sure I'm pushing the right buttons. All right. Well, thank you for that. And how's everything going?
So far so good. Just how it is working behind the scenes, trying to get stuff together. So
Sir. I know. Ooh, I know. But I did see your post about your upcoming session. So I was
yeah,
excited about that. Don't forget, don't make me sir.
yeah, I have an ICD-10 CM class starting on Monday, May 9th at 6 p.m. So I'm excited about that, and I'm trying to just market and do a push. And actually, I mean, I'm on track. If everything works out, I'm on track for this to be my largest class to date. So I'm glad about
Yes.
that.
Good for you. And it's strictly for ICD-10
It's
coding.
strictly ICD-10 CM. Because
Cool.
and the reason why I did it like that is because, like Clarice, like you're aware, when you are in an HIM curriculum, you learn ICD-10 CM and PCS together.
Correct.
And for a lot of people, even when I was tutoring, I found that that's very difficult.
It's hard because
So
it's two separate kind of thought processes and structures. So you're right. You're absolutely correct.
I initially tried to do it like that, and I just found that it was just they weren't getting it. So that's why I broke it down into separate classes.
Cool. Good morning, Vicky. Good morning.
Good morning.
Oh, that's good. Well, I'm excited for you. The largest class today. Okay. We can only go up from here. All right.
That's
All
right.
right. Love it. Love it. So today, let's see. So hopefully by now you all know that the first quarter um coding clinic had been released. And there was a couple of things that I saw that piqued my curiosity. And I was like, oh, especially for my wonderful behavioral health folks. Always have a passion for them since I've had several behavioral health clients. One of them in the question and answer session, one of them is around uh, diagnosis coding for an inpatient condition, and the other one is pretty much, I think, just general knowledge regarding combination codes. Um, so I'll ask, ask the question and then provide the answer that the coding clinic gave. The first one is a patient was admitted for treatment of a malleus fracture of the right ankle. The provider documented alcohol abuse slash monitor for withdrawal symptoms. And that's in quotes. So that was a direct documentation information. The patient also had a history of anxiety and was prescribed Cymbalta during hospitalization. Based on the with convention, IA.15, should we assume a link between anxiety and alcohol abuse and assign code F10.180 alcohol abuse with alcohol induced anxiety disorder? And the answer says do not assume a relationship between alcohol abuse and or dependence and anxiety. Although the alphabetic index links alcohol with anxiety disorder and alcohol induced anxiety disorder is part of the code narrative, an alcohol induced anxiety disorder is not the same as having anxiety and alcohol use, abuse, and dependence. Further, the tabular narrative for codes in subcategory F10.18, alcohol abuse with other alcohol induced disorders, indicates these codes are assigned for alcohol induced disorders, and such a relationship must be documented by the provider. While chronic alcohol dependence, abuse, or use may lead to an alcohol induced anxiety disorder, there can be other underlying causes of anxiety. So these conditions should not be linked, again, unless the provider clearly documents a relationship. And then the second question kind of falls in lines with that and just adds, I guess, more clarity. It says, should combination codes be assigned from categories F10 through F19 mental and behavioral disorders due to psychoactive substance abuse or substance use anytime a patient with a substance abuse or dependence diagnosis also has documented anxiety, mood disorder, sleep disorder, or sexual dysfunction based on the with guideline? And if you are working in the behavioral health space, you know that they always have these additional diagnoses documented for the patients. At least it has been my experience. There's a laundry list of diagnoses that you will run across, in addition to the substance abuse, use, or dependence. So the answer is do not assume a relationship between substance abuse and or dependence and anxiety, mood disorder, sleep disorder, or sexual dysfunction. Although these conditions are terms that are located under with in the index, the narrative in the tabular indicates these codes are reported when the condition is documented as an alcohol induced disorder, and such a relationship is documented by the provider. So the key to all of this is there needs to be some documentation to support all of that by the provider. That is the key. I was waiting for you to come on in. Yes, yes. And we can't just, I mean, I know we have our guidelines and we have things to help us make sure that we're coding accurately. But again, our accurate coding is based on the documentation and based on what the provider has documented about that patient. So, yeah, yeah. But I thought that was great. I mean, like I said, I see laundry lists of diagnoses in behavioral health, and I'm really like, good Lord. And then, well, that's a whole, we can be here for hours talking about them. Because it's like the same thing over and over again. And I'll be like, really? Y'all doing all of this in 15 minutes every single time? Okay. I'd be like, okay, here we go. I think, well, I'll keep that to myself. Like, folks better hope I'll ever work for the government. Ever, ever. But anyway, that is what I wanted to come with you today for our kind of news segment or information coding segment. Mr. Jesse, I didn't know if you had anything. If you did, we could.
But getting back to like the first scenario,
Uh-huh.
I would have coded it with anxiety because it would have, because that's, you can link it with the when it says with. So I'm glad that's a coding clinic, because that's why I'm like, it all comes back to documentation. So in order for it to have been coded with, according to the way it was coded, the provider would have had to have said alcohol induced anxiety.
Correct.
So,
Correct.
so okay.
Because they could have had anxiety due to other reasons, not necessarily. And I mean, especially since that patient, right, and the patient came in for a fracture. Right. Yeah. So I mean, who knows all the circumstances or situations related to that. So it may or may not necessarily have been just due to the alcohol. So unless they clearly document that and link that, no. But yeah, you see all kinds of stuff in that F10 through F19 section. And the games people play, it's ridiculous. It is ridiculous. Cool. So, how is go ahead.
Okay.
No, I was just going to check in with you.
Oh, well, I did have an article from Northwell Health,
Okay.
which is interesting. I saw it on the HEMA website, and I'm like, well, I got it in the, actually not on the website, but in a news brief from HEMA.
Okay.
And it says Northwell Health deploys telemedicine platform to help Ukraine health centers. And I'm like, really?
Let me get my tea ready because I heard all of that in your voice right then and there. Is that what we doing now?
In the grand scheme of things, I'm all for it, because it's nice to be able to help people. But I'm like, seems to me that we'd have plenty of more, war torn and civilian injuries that could have benefited from some telemedicine, from the United States, and they would have over. And it's amazing how, because this is what kind of piqued my interest. It says Northwell's Center for Global Health partnered with the Ukrainian military to launch telemedicine platforms to several undisclosed health centers to help providers take care of injured and displaced civilians in Ukraine. Okay, I understand that, but I'm like, so what's the secrecy? That's what I'm trying to say. I mean, for some displaced people, like, anyway. So first phase is they mobilized the telephone call center to funnel incoming requests to provide a variety of readily accessible mobile platforms. So that was their telemedicine call center, was first set up to help them have mobile platform. Then the second phase is they were going to bring in military grade and high fidelity telemedicine systems, once routinely used in a hospital in the US, to the centers to collaborate on high level cases in our operating room to aid in combat trauma and other procedures. The telemedicine system can be controlled remotely by physicians in the US to change their desired field of view for better patient assessment. The system will also be in vital post-operative care and follow and allow for seamless telemedicine, including telephonic and written translation, to provide support for requests for any specialist within the Northwell network. And I'm thinking, I'm like, that sounds really, really, really nice. And it sounds really, really forward thinking. And that's what you would want technology to do. But I was like, well, why now? They could have been utilizing this technology. I mean,
Exactly.
we've had this access since 2020. So we waiting until other people need it.
Well, we've had our own national disasters, and I mean, not war, of
Exactly.
course, but we've had some. Look at Puerto Rico, and look at we've had a lot of things happen right here at home that definitely could have benefited from this technology. Interesting.
Yeah.
Interesting.
And it's amazing how it was like in the heat of grief I saw it, it was buried deep down. Like you had to scroll. And I'm like, oh, I find it very interesting. It's interesting and then it's troubling at the same time.
At the same time. At the same time. Because you would think, I don't know. And maybe that was just the way I was brought up. You always had to take care of home. Always take
Right.
care of home. Wow. Wow. Okay. That's just amazing.
Yeah.
Amazing. And I'm like you definitely want to provide whatever type of charity that you can. You definitely want to be a partner and assist. I think this whole war is interesting, I'll say.
Yeah.
Because you have people just coming out, pro this, pro that, for this, for that. And it's like, w- where were you before? Like, why now? What? I mean, I know it feels like, to me, it feels like a bullying situation. We all in the yard. It's a bullying situation. You watching the bully continue to do whatever, and while you're in the background, rah rah rah, I guess helping the bullied. What are you doing to really stop the bully? Like, at what point do you just not? But that's, maybe it's me. Maybe I'm looking at it too simplistically. Wow. Interesting. Interesting.
Yeah. So that was the most like things that make you go, when
Mhm.
I saw this. I was like,
Mhm. Mhm. Yes. Um. Wow. 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 I had in my public health class, and this kind of goes to um well, sort of the social determinants, but understanding some of the uh issues that black and brown people face in healthcare situations, and how things are targeted to them, to us, how things are marketed to us, etc. So I'm in my law class, and we're talking about citizens petitions, and then lo and behold, all over the news, you see where the FDA is now releasing their plan to remove menthol from cigarettes. um this thing has been happening. So they were sued years ago, like I think it's 2013 they were sued. um and a citizen's petition was sent on them. And a citizen's petition is when you have like your executive governmental agencies like FDA, CMS, HHS, the whole gamut. And so Congress will give them directives and tell them what it is that they're supposed to do. And they're supposed to do it. Well, when they don't do it, Houston, we got we got a problem. And so anybody, an individual, just a regular individual, can actually sue them to be like, excuse me, ma'am and sirs, you were given a directive to do XYZ. Why are you not doing it? Why is it not being done? So a group, I don't remember where it was, but it's a national group, African American Tobacco, some. I'm gonna butcher your name, and I'm sorry. Group partner with all kinds of organizations, the AMA, the American Public Health Association. I mean, there was a laundry list of groups, and they all partnered and filed the citizens petition. So back in 2021, in April, they actually had their hearing, and the FDA was like, and so let me just say, normally, it's trying to understand, does the FDA actually have the power to regulate tobacco? Well, they were given the authority to regulate tobacco. Now they can't, I don't think they can stop, like, just cold turkey to stop the sale, but they can regulate the products within tobacco. And that's where this menthol piece came in. And so for years they have slowly been reducing or pulling out certain products that are part of cigarettes. Um, there was something with nicotine. There have been all kinds of stuff, but they would never act on menthol. As you may or may not know, menthol cigarettes are the cigarettes of choice for African Americans because it's cooling and it cools the throat. And so it doesn't make it feel as harsh as some of other cigarettes. The problem with that is that it makes it easier to smoke, but harder to quit. So oftentimes you'll have folks saying, I've tried. And they probably really have tried and tried and tried. But that menthol, something about Black folks and menthol makes it really, really hard for them to quit. And so these groups and Congress, who charge the FDA to say stop allowing the tobacco companies to do this, um, felt, well, let us help you, and we'll help you by not allowing menthol in cigarettes. Even though it's going to be an uproar on the other side, that's a whole other conversation too. But at least this is one way, from a public health perspective, um, they can help in reducing the number of smokers and getting folks to quit. So the hearing was held in April 2021. Something jumped off. It was like, oh, well, we gonna do it. We gonna do it. They still stopped. So they were like, they came back again. Here's some more data. Here's some more proof that this is really needed. So they had another hearing. The other hearing, I think, was in September. They were like, okay, by April 2022, we'll come up with this plan. I guess almost at the end of the month, they formalized and put together what that plan is supposed to look like. They still don't anticipate this happening this year, because my understanding from the article, they are anticipating still some resistance from big tobacco. They're still anticipating probably some additional lawsuits and all kinds of stuff as it relates. But they have the support of Congress, they have the support of these groups, and they're like, do something. Don't just not do something. So this has forced their hand, and at least there is now a plan. I mean, they're the way they were operating was like, well, yeah, we know we got to do it, but it's back there. We'll get to it when we get to it. So I thought this was good news, and it kind of tied into what we were learning about the citizens petition, because I was like, oh, I didn't know we could do that. Okay. Hmm. Let's get to writing. No. So yeah, that was something else that when you talked about um well, this one wasn't actually buried. Actually, it was everywhere, because I was like, well, wait a minute, hold up. We normally do a current events in our class, and so it popped up, and I was like, Well, look at God just popping something right in my face so I can have a current event for this week. Look at God. But then I had done a paper on it in another class. So I was excited to see it because they had been talking about it. And I was like, well, nothing is happening. And then I had been talking to some folks that I know that smoke, and they were all in their feelings. Well, what you mean? Because that's the cools and the Newports and the cigarettes that black people smoke. And they're also, so not only is it menthol, but it's also grape and strawberry in cigars. And those are flavors that teens are very, very popular with teens. And so they're um regulating removing those flavors as well from the cigars.
Well, that's very interesting, and I think the link between black people and menthol is the same. That would explain the link that black grandmothers have on Sunday by having a piece of peppermint in their purse before they go to church. It must be something.
Well, peppermint, interesting that you say that, because I would tell my students to make sure that they have peppermint when they're testing. It gives you an alertness. It keeps you alert. So, if you done partied all night at the juke joints, like, let me stop. And then you got to go to church on Sunday morning. You want to make sure you're alert and you're not falling asleep. And you're saying amen when appropriate. So you pop that peppermint in your mouth and you ready.
I just remember like my mother making notes to buy peppermints to have peppermints, and you could go to any black woman's purse on a Sunday and find some peppermints.
Amen.
And it's
Amen.
just so. I mean, but I think that what is so interesting is the whole smoking thing is just, and I get why. Well, for number one, they wouldn't ban it, like because I think they really realized through prohibition that banning something is really not the way, because you're not going to stop people from having access.
Mm-hmm.
So, and the whole tobacco thing, Philip Morris went through so much, they even changed their name.
Mm-hmm.
So, um, but I think that there is a way that, I mean, if there's something that is detrimental, and we have to be very honest, like it was meant to be addictive. They knew it was addictive when they created it.
Correct.
So they created the addiction, and I think that it is up to them to stop the addiction. I mean, because honestly, if you're going to regulate cigarettes, cigarettes are just as damaging as cocaine. You might as well regulate cocaine. You might as well regulate crack. You might as well regulate it all, because it all at the end of the day is damaging.
Mm-hmm.
And at the end of the day, it costs all of us as taxpayers way more.
Mm-hmm.
And because these companies walk away to make record profits, and these people, even if they start off with insurance, if they develop a debilitating condition, or they develop some kind of virulent type cancer, they're going to end up losing all their personal property. Then they're going to end up on Medicaid, which ultimately the taxpayers put the bill. So it's just bad all the way around.
Mm-hmm.
And I get, because like in New York, which is so interesting, because the price of cigarettes in New York is ridiculous. I never smoked, thank God. But
Me either.
and I moved in 2016 back here to Philly, and I think then a pack of cigarettes was $13. And what people were doing was people were making their own cigarettes. Like they were buying tobacco, buying leaves, and rolling them like no filter, no nothing, and smoking them.
Wow.
And that's even worse because now you're getting all that like straight in.
Mm. Yeah, that was the other thing somebody mentioned. Because of course, once I talked about the article, we went into a full blown debate in the class, but how it may then go to the black market, and people would do all kinds of things to have um cigarettes, to your point, creating their own and so on and so forth. And it's like, wow. I mean, yeah, but I'm glad. Just like they stopped them from directly mark, because if you think about it, and I once I was reading this, I thought about it, like, that is the truth. Like, our music festivals were hosted by like Cool or the smoking industries. When I was a kid, you would go to like the neighborhood store and you would see all posted up, the pictures of the people smoking on the walls, the various brands of cigarettes, all this direct advertising right there at the counter. We just trying to go get some penny candy. Here we are bombarded with smoking advertisement just at our corner store. If you went to the club, all the little trinkets on the bar or all the little stuff was usually, now it's mostly, I guess, alcohol companies, but before it was smoking tobacco companies actually putting their marketing materials in the clubs and stuff. So yeah, this is go ahead.
It was even in sports because I remember
Yeah.
in the 80s, Virginia Slims used to sponsor a women's tennis tournament.
Yep. You're right about that. So it was everywhere.
Yeah.
Everywhere.
We have Demetrius and Kaya.
I see, and Kathy as well. Welcome, welcome.
Good morning, everybody.
I think I asked Demetrius if he wanted to come speak, and I'll just send one to Kaya. Feel free to come up to the stage and say hi or join in a conversation. And good morning, Evolving 365. We got them checking in on YouTube as well. Yeah, so that was real interesting. It's been some interesting tidbits. And so again, just
Kathy says that she remembers when she was younger walking up and down 125th Street in New York City and them giving out samples of cigarettes on the street.
shut up. Oh my God, not a whole sample. Let me ruin your life real quick. No, I'm kidding. Wow. Were they giving it away to anybody? Kids, everybody, or just,
I'm probably sure it was within reason.
Oh, hopefully, prayerfully. Oh, we had Asha in the room earlier. She's sitting for her exam. So everybody say a little, throw up some light and love for her as she sits for her CPC exam. I'm sure she'll do fine.
Now, I'm speaking of the CPC exam. Can I tell you? Um, I looked at the uh, I went to the AAPC website. I looked up the CPC study guide. And they have like some sample. They had like some sample questions,
Mm-hmm.
and I'm like, I think since they have changed like cut it down to 100 questions, I think the questions are formulated differently because I'm like, I actually like the couple questions I did that I saw, I actually liked. I'm like, this seems to be a little different from them, like a little, because their questions used to be, I don't know, they were a little lengthy out there.
Well, yeah, those scenarios. So, because they still have those kind of scenario based questions, but they've grouped them towards the end of the exam, so they'll have those. But hopefully, with all the research and testing and money that they have spent to determine what to do in changing their format, hopefully um they've gotten some good takeaways and have applied them. um I'm like you, I still want to see the numbers though.
Because can I just? I'm just gonna say it, but that's what I do.
That's what you do, sir. Let me grab my tea and my pearls. Come on.
That the CPC has just copied Naheem's format because I'm not going to say that they had easy questions, but Ahima has their multiple choice questions that are very straightforward. Either you know it or you don't.
Uh-huh.
In the beginning, then towards the end, you have these cases that you have to do towards the end, like the scenarios
Uh-huh.
that you have to read. And I think that that's really just, I mean, low key, that's what the new AAPC format is.
And I think it should be that. I mean, they always say, well, we're not trying to trick you. Really? I mean, test the knowledge. Don't and I agree, don't just test coding, how to code. We got that. Test the knowledge. So continue along the vein of testing the guidelines, testing the guidance, testing sequencing, testing those types of things based on your scenario. But don't muddy the waters, for real, for real. Especially because it's timed, especially because that's what makes it bad. And I think often a lot of people, even those who had been unsuccessful in passing their exam, especially those who are not um coders, are bringing, and I tell my students all the time, even if you're working in the field and you're coding, do not bring that stuff to this exam. It's not the same. Do not bring what you do at work into this exam. Go strictly by the guidance and the information that you have presented to you in your manuals, period.
But for me, because like they're saying they're not trying to trick people, but yet still, what I never really liked about
Right, Demetrius.
operative reports, it's so much useless information.
It is, and it's like you get caught up because you think, you nervous, you don't want to miss anything, and so you try to get everything, and then you didn't mess the whole scenario up because it was really just do this.
Exactly. Or you go through this whole long scenario when really all you needed to do was look at the name of the procedure, and then somewhere along the line they use some kind of C-arm robotic thing, so that's an add-on that they could have accomplished the same thing, just doing it with a whole lot less verbiage.
Right. Or it took an extended amount of time, so that's a modifier you need to add on. Just there's other ways to do that. It's other ways to just keep it simple. It's other ways to provide the necessary or unnecessary information without scaring the bejeebies out of people when they see, like, oh my God, and most and I'm sure you can attest to this. When you do introduce like longer scenarios to your students, you hear the moaning, the groaning, oh my God, what is this? I can't do this. If you don't sit down and read that and break that down, come on now. But the thing is, in a classroom, or even if we're teaching online, in that scenario, you have time. You don't have time. Time is not your friend in these exams. So that's where I think it becomes problematic. That's where it becomes challenging for folks.
I would agree.
Hmm. I may have to order me one of their study guides and see, or order some questions to see
Because that's
what they look like.
like. Because this is because it is definitely they have definitely made some changes. And I could just tell that just from the couple of questions I saw. I'm like, this is not like that.
Hmm.
And I actually like it. I mean, this makes more sense.
Well, look at you liking that. I'm shocked.
I'm serious, like
I know. I know. You be the first one like, we're not doing that.
Exactly. Because I thought I've always purposely I always thought that they made their exam unnecessarily difficult. I think they could have just accomplished the same thing, and I think that honestly, I think that because of the feedback, and they changed for a reason. The reason why they changed is because that first time pass rate was abysmal. I don't care what anybody says. Nobody changed it for no reason, especially a total revamp like that. They have revamped their entire testing process. So something was not working.
And I took my exam a long, 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 long time ago. And trust and believe that exam, baby, I walked away. My shoulders, I needed a massage. I mean, you're so tense, and you're so um just you're so focused, and you're so tense, and you don't want to make mistakes. You don't. And I mean, I did very, very well on my exam, I must say. And passed it on the first time. But that's why I keep my credentials, because I will never, ever, ever, Lord willing, ever, 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 ever take that test again. We're not doing that. Look, if I gotta do something strange for a little piece of change in order to keep my certifications, I'm gonna do it. We're not letting those go. Oh goodness. Oh, well, hopefully, again, like I said, I dropped my video this week was about the changes to the online exam. Um and how, what they did, most of the information that they put out there was kind of, it was generic, and it applied to both. But I got a lot of questions from people like, well, what about the online exam? What about the online exam? And it's a little different. I mean, it because the online exam is in two parts. So you still got the same number, so that 100 questions is the same and the 4 hours is the same. They just split that up into two. But that online exam just seems like a doozy to me. Every time someone comes back and tells me about their experience, it's like,
So
be,
what are they saying?
be careful for what you wish for. Well, so you have to have an additional, it's just the way they proctor you. So you have to have like an external camera. So you can't have like just your webcam on your computer. You have to have some sort of external camera behind you to be able to watch, and for them to be able to watch and monitor your space that you're working.
Who has that?
Sir, be like, you got to pay extra money just to take this exam. Um and then so it's all of that. And then someone said that I guess they can kind of remote into your test, or remote into, or do something while you're testing. So someone said they were taking an exam, and the proctor remoted in and did something, which just kind of threw them like, whoa, 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 whoa. Like, we don't have time for that. I'm on the clock. My clock is ticking. I don't need any beeps, bloops, or anything, because I'm trying to finish my exam. And then what else were they saying? Um, I know the whole webcam thing was a big thing. Oh, so it's, and there's a way to, I put it in my video. There's, as a bonus. So the questions just pop up one at a time. So you don't have the luxury of seeing like, okay, well, let me see what I can go through and whatever. Unfortunately, when we talked about this before, they don't group them together like they used to um by category or by area. It's all over the place in there. But at least in the face to face, you can kind of go through and look and see. You don't get that in it's boop, here's a question, and you got to do something and answer and then go to the next or whatever. So
You can't mark the review and come back.
there is a place to do that. They don't tell you that. But yeah, there's a place where you can do a completion or check for completion, and then you can go back and see which questions you have not answered and then come back and do it. But again, all of that is time. All of that is, and so you have to factor. So your time is actually a little less when you're doing online, because you got to factor all the things that you got to do electronically. So I don't know. I don't know.
But now see, that was because Ahima came under some flack, and I have to do some research to see if they changed it because I think it was earlier this year they said that you couldn't skip questions anymore because for Ahima you could always mark a review and come back. So I always told anybody when you're taking a Ahima exam, if you can't get the answer in the first minute, if it doesn't jump out at you, mark it for review and move on because you can build time on the back end if you go through all the questions that or can answer pretty quickly. And that's what I always did because like Ahima, they have it's in two parts. So you have to finish the first part in order to go to the second part.
Right.
So when you mark the review, all of the questions for the first part come back up for you to go back and look at. So then once you finish that, then you start part two. Then when you do part two, you do it the exact same way. The cases that you can get through quickly, because you have 8 of them. The cases you get through quickly, knock them out. The ones you can, pause and then come back. And so you can have time built up in the back on the back end to give you extra time.
Mm-hmm.
So would that work for these exams?
You would hope so. But and that's a good, well, there are different vendors that are doing it with them, but that would make sure that you don't miss anything if it automatically comes back up if you mark it for review. Um That's interesting. I have to dig deeper and see if I can find some more information. Hey, Demetrius.
Hey,
Good morning.
good morning. I wanted to, well, good morning, everybody listening to. I wanted to jump in on the online experience since I did my CPC online recently.
Oh, come
I
on,
did it
yeah.
before. Yeah, I did it before they did the switch. So I did the old CPC test, but I
Hmm.
did it online. I have to agree, it is like a whole another process, like as far as time management on top of worrying about testing because I think I know I had at least I want to say 30 minutes. I gave myself 30-minute gap to start early or whatever because I think the recommends 15 or something like that.
Hmm.
Um, and it was so tedious, like the setup. Well, first of all, my partner was like foreign, so I couldn't understand half what she was saying.
Uh
That was one problem. And then the other problem, I remember one thing that really stuck out to me was the whole camera setup, the external camera, because you have to have it at a certain angle.
oh.
It's
Hmm.
an angle that you think is right. It's an angle that the prop is. So let me say, I spent at least maybe of those 30 minutes, 15 to 20 minutes moving the external webcam. And I finally was able to get it right by maneuvering. I think I had like a roller paper towel and I had it at the edge of the table. I had to turn the camera like a very meticulous way. I thought, oh my God, Sledge, I should just look at it first. I was already nervous about the test, and that really wasn't making it any better. So I'm just like, why can't you just like I don't know how they was able to improve this, but this ain't it.
Oh.
And then on top of that, after I got well, and then you have to have, in addition to that, you have to have your books and stuff or whatever approved material you can use. It's got to be all in a certain laid out in a certain way.
Wow.
Area. Yeah, and the prop is supposed to direct you on all this. And it's like it's so tedious because it's like I'm sitting at the desk and I'm trying to get everything right. And she's like, "Oh, move to the left. No, a little bit over to the left. No, my left." This is oh my god.
Right, like I'm trying to get I'm one. You trying to get your mind right because you're about to sit here for this exam, and
Yeah.
that in and of itself is anxiety and stress promoting, and now I got you in my ear with the this no 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 no.
And then to top everything off, once I finished my test, I'm waiting for them to confirm. Nobody never confirmed. She never came back. So I was scared to like do anything because I didn't want them to be like, okay, like you weren't supposed to do that. You get penalized or something. Because you have to wait for them to confirm, and you supposed to just be like, I'm done. And I was saying, I'm done. And I was sitting there for like 15, 20 minutes. So finally, I ended the session myself, and I just immediately messaged customer service to let them know, like, I finished my test, and nobody never like said anything. I'm
Look,
like,
she dipped on you.
yeah. And then I'm just like, okay, well, I don't want to do nothing. It gives you certain instructions to just stop, or I think she told me when I'm done to let them know and raise my hand or something stupid. Excuse me, I didn't mean to say stupid.
No, no.
Yeah, so I ended up messaging customer service immediately afterwards, and I was freaking out. So, oh Lord, I didn't do something wrong, but it wasn't me. It turned out they lost connection or something crazy. It was a mess.
Oh, wow. Wow.
So
And you were successful with passing your
yeah,
exam. Yes,
yeah.
yes.
So I can relate with you saying like you guys y'all got y'all thirsty. I don't want to take no. I don't want to take that again. So I put that's too much. I
Ooh.
just wanted to say that.
Well, I appreciate you. Thank you for sharing your experience. That's what's up.
Yeah, no problem. Yeah, they have definitely some process improvement on that.
So yeah, so you got that, and again, you took the longer one. Now you
Mm-hmm.
got the shorter one, and so you even have less time to fool with that foolishness.
Yeah, yeah.
Wow.
So anybody listening, like, if you taking it online, at least give yourself. I would just say 15 minutes, but I would just be up there in 30 minutes, like, because it's gonna take a while for the setup. Just be prepared for that.
Wow.
It's not wham bam and start. It's, I don't know. That's what I thought it was gonna be, but it wasn't.
Mm. Yeah, Vicky, from where she YouTube says, I heard that with AHEMA you can't flag the exam anymore.
Yes.
Wow, that's a mess.
I'm wondering if when they're going to change it because that's not fair. That's a whole different level of test taking right there. Yeah, for my exam, I did that. For my record exam, I had flagged questions that I didn't know, and I just went ahead and skipped. And I think, like what Mr. Jesse was saying, I had a good amount of time to finish those questions and double check my whole text. So that alone, that process does save you a lot of time. I have to say. Mm-hmm.
Wow. So you got to not only be on top of the material for the exam, but then you got to be on top of the way in which the exam is being provided. Goodness.
Then I couldn't even when they were trying to direct me on what to do because the English was so broken. I was having trouble understanding what the directions they were trying to give me. So it was not up to par. Very 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 so.
Thank God you passed it.
Oh yeah, I was so happy. I think I got that. I It was funny how I realized I passed because I didn't see the pass results, but I noticed on my AAPC website they added a new section, for the CPCA thing, and I was like, wait, why they got? I was like, oh wait, if they got this, no. I was like, no, it's not true. I see the official pass as well. I just thought I noticed on my membership they added a new section I could look at, and it was about CPCAs, and so I was like, oh, well, why they got? I must have passed
it. Well, I know years ago, and of course, I'm about to date myself, but they used to mail you your results, and you would know because if you passed it, they would put the credential on your name on the envelope. But if you didn't, they didn't. So you didn't even have to open up the letter. You knew right then and there. Like, yeah.
I don't know if that's a good thing or a bad
thing. Right. Well, I don't know if everybody really paid attention and knew that. Because, some folks would be like, they just looking where it came from and they excited, they opened up whatever. And, that word spread around. Everybody was looking like, I don't even need to open this. Or yay, I can open it.
They had to say they were saying the same thing in nursing because back in my day, they mailed you your results too, and everybody got their results on the same day. So they were like, if you get a big envelope, it means you didn't pass.
Oh,
a little envelope, that means you passed because it's just announcing that you passed with your license number. So the year I took mine, they didn't do it that way. Everybody who failed got theirs the day before.
Oh.
So my phone is ringing. A couple of people called, but did you get your results? I said no. I got mine. I didn't pass. I said oh, well I didn't get mine. So of course now I'm like panicking because I'm like everybody. How come I don't have my results? The next day, here's the next because I was in school. I lived with my cousin for a brief period of time, but I never changed my address when I moved to my apartment. So everything went to her address. She lived in the suburbs. I lived in the city. Mm-hmm. So the next day results come out. I call her boyfriend and I'm like, "Do I have mail there?" He said, "Yeah." I said, "Can you open it?" "No, I don't open people's mail." I said, "Are you kidding me?" he did not open my envelope. I had to go. I had to leave the city and go to the suburbs for public transportation.
Oh wow!
Speeding a mile a minute. I get there and I see this envelope that's small. And I open it up and it was my license.
Oh, he like for real, dude.
He was serious. I'm like,
that is a federal crime to be opening up somebody else's mail. Look, he already look. We know them statutes. Oh, wow.
So that waiting
Yes, you'd be like, "Woo." So I'm glad, now that things are electronic, you can get your results quicker and they can, grade them quicker and all of those things. So that's a plus, but you still got to deal with some of the other stuff that as they're reformatting and changing the way in which these exams are being proctored and had. But all of AHIMA's things have been electronic for a long time.
Yeah,
Because I
they
took
just
my
skipped them.
my well, my RHIA was electronic. My CCSP was also electronic, and I took that a long time ago. So yeah, their stuff has been. I mean, you go to the testing center but that's typical with other organizations. I know my daughter in taking her counseling exams, they have to sign up and go to the testing center and do it there.
Yeah, I had to go to Pearson a couple times, aside from because they really got a racket going. Because I had to go there for my cosmetology practice for my written exam. I had to go there for my barber manager written exam. So they get it. They got it covered.
Wait a minute, hold up, sir. Hold up. I mean, I know you a jack of all trades and all of that. So, would you just saying that? So you can actually you have your license. Look, I done put a whole scenario together for you. Like you have your license. You could be a DME provider. You can create the device. Sir, you follow me now? Bill,
Yeah,
bill for the device, of course. Code for the device.
yeah,
All of the things. Look at you.
yeah.
Love it. Love it. That's what's up. Multiple streams. It's always about multiple streams.
It is.
Multiple streams. Cool. So one thing I needed to tell you, I was talking with one of my friends, her mom, which is she's one of my oldest, dearest besties. Her mom passed last week and we had her funeral um Thursday. And the and the folks there, she's from, I don't know if she's from Pennsylvania, um but she has a lot of family in Pennsylvania, so a lot of the Pennsylvania family, Philadelphia folks came down. And so we're talking about doing a trip, and I said if I go to Philadelphia, I'm gonna have to find my co-host, and we
Yeah,
definitely gonna do lunch. We may even open up a quick broadcast right there together.
yeah.
So we're talking. I think she said her brother has never been, and they're thinking about doing something in June. So I will definitely keep you posted. So that would be,
Please.
yes, that would be fun. That would be fun. So I was like, let me tell him. First, I was like, no, I'm a surprise and pop up. But you never know. You can be off traipsing the world doing something, getting another certification or something on you. So
Right.
it's like, no, I need to let him know.
That, that's perfect.
Yeah, yeah. I was like,
I will
this is
be
all
there.
good. This is all good. So yeah, this was a good session today. Good
Yeah.
session. Even though I was like, okay, there hasn't been really a whole lot of, to your point, even like last week, there hasn't been a whole lot of coding stuff directed um
No.
information. And then, like I said, in my email to you, we're gonna sit down and talk about our format change a little bit. So that'll be fun. Um,
Yeah.
and then we have to, me, we're gonna have to test it because Lord knows I don't want it to fall apart as we're doing it. Like, wait a minute, where did the slide go? I know we had a slide up here. Where did it go? Ah, so yeah,
But
that
like
I
I said, it all like these people at the end of the day, it doesn't. I mean, it's all about you have to know and master the guidelines. That's the
hmm
secret sauce.
that is. That is. And all of them for all of your manuals. Um,
Yeah.
don't sit them out thinking, oh wow, I don't need this or that and the other. No, you do. You need it all. You need to understand it. Um, because that's how you play this game. called coding.
Absolutely.
That's
That
how you
is
play this game. That's how you become the expert. That's how you become the what do they call them? Thought leaders. That's how you become
hmm
the people that they're calling for this, that, and the third. That's how your inbox stay full, like mine, and I'm sure yours, with a gazillion
my,
questions.
mine gets it gets it gets a little traffic here and there, but I mean I'm not busy, but it's all about and what I thought about and what I thought about really seriously is it's all about branding too. Like you
Hmm.
really have to put yourself out there
You
as
do.
a thought leader, as a subject matter expert to be taken like that.
You do. You do. I agree. I agree. And I think this was one opportunity um, for us to do just that and to help people along and show them, even though we do give all kinds of information, but to show them, some of the behind the scenes, behind the curtains, eyes look into what this profession is and how that they can be successful in whichever way they choose to go. Because you can be successful. Um, Even if coding may not necessarily be your jam, some other portion of health information may be it. I think somebody reached out to me the other day and was like talking about release of information and talking about other areas. And I was like, it's so broad and so open. There's so many opportunities, whatever your passion is. But to me, that's the key. Make sure you do something that's your passion. I mean, if you're not feeling that, don't invest that time, money, and energy into that. If it's just, something that's gonna be fly by night. Now, if it's something that you're gonna build upon, because I believe medical coding is actually something that you can build upon because it bleeds into so many areas within healthcare today. And I mean, even if you're into health law, and you need to understand what the documentation says, well, what do these codes mean, or what is, you lawyers, they contract or they call upon um coders and other healthcare professionals who are in those records to help them understand, well, how do I interpret this, what does this mean, what should we be seeing, and that kind of thing. So I mean, it's just all over the place. I'm so grateful and thankful that um you know I didn't want to get into the blood and gore of healthcare, even though after I got my um education with health information, I really thought about becoming a physician. Um, but then I was like, no.
But it's so funny that you would mention that because there's just it's just so many. You're right. It's just so many avenues and there's so many ways to get in, and people just have to. It's an amazing industry, and
It
you
is.
really can find some place for you that you like.
Yep.
You really can. And one thing, and I think that this really might be an opportunity for you and I, like, see on a serious business tip, is there was a doctor that I just knew from social media had told me a while ago that I should contact medical schools and just and contact them about coming in and being a speaker about just the reimbursement piece because a lot of doctors don't realize that it all comes down to documentation. And the sooner you learn how to document properly, the sooner you will become a better physician, and the sooner you'll keep people from flooding your inbox with questions.
And don't we complain about that all the time?
Actually,
Like they
you
need to
mentioned
have this. Yeah, yeah.
right, you mentioned about even in law. Actually, there was an attorney. There's a healthcare attorney who actually taught me how to do a Freedom of Information Act request from CMS. I was like, well, how do I get this information? And they were like, do a Freedom of Information Act request. I'm like, you could do that.
Yes, it's so many things we don't know, but we're gonna get there. with all the collective brain power that we have here within our family of folks, both in Clubhouse, on Facebook, on YouTube, collectively, we're gonna get there. Everybody brings something to the table. Don't think that you're not here for a reason. You're bringing some information. You're bringing something to the table, and we want to encourage you. Don't be shy. Come on up, especially if you're in the Clubhouse. Don't be shy. Come on up. We invite folks to come to the room. It's multi-purpose. One, for you to hear the information, but then also for you to provide information and for you to see what it looks like on the other side if you're on the stage. Because hey, you may feel compelled that there's something that you're passionate about and you want to open your club. So we're providing you kind of hands-on training on how to do that. So yeah, we open up. It's family here. We open up, we share. We share. Cool. Cool. So, Mr. Jesse, do you have any other closing thoughts? We are at the top of the hour.
No, once again, I'm just grateful and appreciative that you have created this space, and I'm glad to be a part of it. And I think that we definitely, as we always do, is provide value.
Yes, yes. So again, thank you everybody for joining the Saturday morning tea. Again, was the tea spilled today? I believe it was. I believe it was.
Me too.
I done drank all my tea today. Yeah, all of it. It's absolutely all gone. If this information was valuable for you, help us share this message with others by liking the video, sharing the video, and subscribing to our channel, the Professional Reimbursement Network. You can also check out the Coding Nurse channel on YouTube. Hey, Tasha, thank you. Thank you. Um, so yeah, feel free to check us out in all of our social media platforms. We're also on Instagram, we on Facebook, you name it, we're there. I had a TikTok thing, but that's a whole other animal that who got the time? But anyway, I guess you're gonna have to make the time, huh?
I don't know. TikTok has to be for the unemployed, or they have this thing because it's a whole lot. It's a whole lot of moving parts to TikTok.
It's a lot. And I'm a dancer, but I'm not gonna be dancing with a code book. It's like, let me stop. I don't know. It's just a lot.
You have to, even once you do the video, you have to have a sound because then you got to go and pick out the most trending sound. If you have the most traffic, I'm like,
it's a whole strategy in and of itself. Bless their heart. You said it is for the unemployed. You are hilarious.
I need me like a 19-year-old cousin who ain't doing too much.
We need a whole team. Let me throw you some dollars and you just take this and run. Oh, but yeah, we're out there on all those social media platforms, so feel free to look us up. Of course, last but not least, to my Clubhouse folks, make sure you click on the greenhouse to join the fun in our club, and of course, you will get notified of our live broadcast. And we're typically here every Saturday morning at 9 a.m. Eastern Standard Time. Again, this has been a great session today. Thank you all for joining, and remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care and have a great weekend.
Thank you.
Bye bye.